This is Dr. Ihab Abdurrahman Ihab Tarawa, consultant for acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum. We are still doing our course on medication safety course, introduction to medication without harm. This session is about safe prescriptions. This is session 2. Objectives of this session to discuss importance of proper prescription and then to discuss the prescribing process by defining patient problem, specifying the therapeutic objectives, verifying the suitability of treatment, start the treatment, give information to the patient, and then monitor the patient. In the last session, we concluded that we select drug based on efficacy, safety, convenience, and cost. Here in this slide, you will see that, for example, the oral medication, sometimes efficacy is uncertain because of the absorption. And this can impact the safety because there might be a low peak value or uncertainty with absorption. And the convenience of taking oral medication, if you have large tablets, it will be difficult to handle by elderly and some children, and then you need to switch to a liquid form. For sublingual or aerosols, they act rapidly, but at the same time, since they go directly from the mucous membrane to the blood, you can achieve overdose easily. The MDI inhaler sometimes difficult to handle by children. Injectable, they are fast, they are very effective, but also overdose can happen quickly, but they are painful and you need trained personnel to do them, and sometimes you need to teach the patient to do them, as in case of insulin therapy. Topical, these high concentration possible, limited systemic penetration, sometimes the skin desensitized, and the convenience when you are using like suppository and vaginal route. Choosing standard duration of treatment by our knowledge about physiology and pathology, pathophysiology, and prognosis of the disease, we will be able to have good idea of how long should we treat this patient. For example, if you have a malaria or pneumonia, you know that you need to treat for a few days. But some condition like diabetes and hypertension or Parkinson's disease, you need to treat for a long time or even lifelong. In heart failure, you have to give lifelong treatment, but one patient is overloaded, you give adjusted dose of diuretics till you get them to euvolemia. The total amount of drug to be prescribed depend on the dosage schedule, duration of treatment. If duration of treatment is not known, then we need to get the patient back sooner so that we can make the adjustment. When we are starting treatment for hypertension, for example, maybe we prescribe for a couple of weeks and the patient should come in 7 to 10 days to make sure the dose is suitable and is getting the blood pressure to the target. In some drug, we have to increase the dose slowly, like in tricyclic, some anticonvulsant, anti-Parkinson, ACE inhibitor, especially in patients with diuretic, alpha blocker, some hormone like corticosteroid and thyroxine, and gold for rheumatism. Also, many of these medications, they need tapering when we stop them. Amphetamine, anti-epileptic, antidepressant, antipsychotic, some cardiovascular like clonidine, methyl-dopa, corticosteroid, hypnotic benzodiazepine, and barbiturate. Is the standard duration of treatment suitable for this patient? Many doctors not only prescribe too much drug for too long, but also frequently too little for too short period. In one study, about 10% of patients on benzodiazepine receive them for 1 year or longer. Another study showed that 16% of outpatients with cancer still suffered from pain because doctors were afraid to prescribe morphine for a long period. They mistook tolerance for addiction, the duration of treatment, and the quantity of drug prescribed should also be effective and safe for the individual patient. Overprescribing when we give more medication or for longer period may lead to many undesired effects. The patient receive unnecessary treatment. The drug may lose some of their potency. Unnecessary side effect, we expose the patient to unnecessary side effect. Quantity available may enable the patient to overdose. Some in hypnotic and narcotics dependency can happen, and some reconstituted drug such as eye drop and antibiotic can become contaminated and lose efficacy. And when we under prescribe, treatment is not effective, and more aggressive, expensive treatment might be needed later. Prophylaxis might be ineffective if you prescribe shorter duration of anti-malaria or smaller dose. It might not be effective. Most patients will find inconvenience to return for further treatment, and also money is spent ineffective treatment, and it is a wasted money. After you define the patient problem and you determine your therapeutic objective, and you select the medication based on efficacy, safety, suitability, and cost, then you exercise the prescription writing. You need to write your name and your telephone number and the date. Drug should be written. The generic name is very important. If you believe the brand is necessary, you need to write that. And you need to write the dosage, the strength, the amount, and also there should be a label to giving the patient the important information, and also patient name and age, and you have to sign at the end. The perfect treatment, a well-chosen drug treatment consists of few drugs as possible, perfectly only one, with rapid action, with as few side effects as possible, in an appropriate dosage form, with a simple dosage schedule, and for the shortest possible duration. Adherence and lack of adherence to treatment. Patient adherence to treatment can be improved by prescribe a well-chosen drug treatment, create a good doctor-patient relationship, take time to give the necessary information, instruction, and warning to the patient. On an average, 50% of patients do not take prescribed drug correctly, or sometimes they take them irregularly or not at all. The most common reason are symptoms have ceased, side effects have occurred, the drug is not perceived as effective, or the dosage schedule is complicated, especially for elderly. Patient information are very important. We have to educate the patient. We need to tell them about the effect of the drug. Why do they have to take this drug? Which symptom will disappear and which will not? And when the effect is expected to start, what will happen if the drug is taken incorrectly or not at all? If they forget the medication, when they should take it. They should know about the side effect, which side effect may occur, how to recognize them, and how long they will continue, and how serious they are, and what action to do. And you give them instruction about how the drug should be taken, when it should be taken, and how long the treatment should continue, and how long drug should be stored, and what to do with the leftover. And also you have to give them warning, what is the maximum dose, and any precaution regarding this medication, and what to take with it and what not to take, and the importance of full treatment. And they have to know about when they should come for future consultation, when they should come back, and on scheduled time, and when to come earlier, and when they recognize symptom or lack of effectivity, and what information they should tell the doctor when they come next time. And at the end, you ask them if everything is clear, and you ask them to repeat the information and give them a chance to ask any question. The final step is to monitor. Monitoring treatment enables us to determine whether it has been successful or whether additional action is needed. We can do this passively or actively. Passive monitoring means that you explain to the patient what to do if treatment is not effective, is inconvenient, or if too many side effects occur. While active monitoring means that you make an appointment to determine yourself whether the treatment has been effective. Sometime when we start treatment, especially for blood pressure or diabetes, we might need to get the patient sooner. When the patient becomes stable, then you can space the monitoring maybe every 3 months. So if disease is cured, this means that treatment was effective and you can stop the medication. If disease is not yet cured, or if it's a chronic and treatment is effective and without side effect, you continue the treatment. If side effects have occurred, you should reconsider your selection or your selected drug or dosage schedule and check whether the patient has correctly instructed. Many side effects are dose dependent, and sometimes you can just lower the dose. If treatment is not effective or with or without side effect, we should consider the diagnosis. We have to revisit the diagnosis again, and the treatment which was prescribed, we should check the medication again, and whether the dose was too low or the interval is not appropriate, and whether the patient was correctly instructed, and whether the patient actually taking the drug, and whether we are doing the proper monitoring. When we determine that the treatment is not effective, so the best advice is to go again and do the process, try to define the patient problem and set your therapeutic objective and verify the efficacy, safety, suitability, and convenience and cost, and also how the patient is instructed and what to monitor. Sometimes you will find that there is no real alternative to treatment that has not been effective or has side effects. We should discuss everything with the patient, and when treatment is not effective and not working, we might have to stop it. Take home, proper prescribing is important process for patient care and patient safety. There are a lot of medication and remedies with variable efficacy, safety, suitability, and cost. We have to choose wisely. We have to go through the process of proper or rational prescribing, which include define patient problem, specify therapeutic objectives, verify suitability of treatment in terms of efficacy, safety, suitability, and cost, start treatment, and write proper prescription, including all the information about the medication, about yourself, about your patient, and give information instruction to the patient and monitor your patient. And thank you.